Let's talk about the emergency brake for HIV. I hope that you've seen my other videos on pre-exposure prophylaxis, but this is a video that you need to see if you think you've been exposed. PEP stands for post-exposure prophylaxis. So in plain language, it's a short course of HIV medication that you take after possibly being exposed to reduce your chances of becoming HIV positive. Now, this isn't the same thing as PrEP. That's what you take before exposure. PEP is oh no, something just happened. When PEP is used, think about situations like if you're having sex and the condom breaks, or a situation where, there's sexual assault involved. Think of situations where you might have had sex with someone and you didn't know their HIV status. Understand that you can get post-exposure prophylaxis, and that's why we treat this like a medical emergency and not something that you want to wait and see about. So what you need to do if you think that you've been exposed is talk to a physician. The medication is usually a combination of HIV medicines. Take it for about a month. So make sure you get tested before you start, and also get tested about a month afterwards. The goal is to throw everything we can at the virus before it has a chance to settle in to your body. Now, there are some key limits. You have to know that PEP is not a substitute for PrEP, condoms, or safe sex planning. It's an emergency tool, right? It's not a long-term strategy, and it doesn't protect you from pregnancy or any other STIs. So just understand that you have to tell your clinician exactly what happened and what you're worried about. But if you think you've had a possible HIV exposure, don't wait. You can go to an ER, or urgent care, or a sexual health clinic and say the words, "I think I've been exposed to HIV, and I want to ask you about PEP." PEP, post-exposure prophylaxis. And again, understand this is general education. It's not your personalized medical advice. But if you ever find yourself in that oh no moment, just remember these three letters, PEP. It can help you out in the case of an emergency where you want to make sure that you're preventing HIV. It's Dr. Erica R. Jones, I'm a board-certified family medicine physician, just here to break down some complex topics for you.